Hi guys, this is the part 2 of the brachial plexus. So today we are going to discuss about the components of the brachial plexus. So if you see in this picture, see this is the brachial plexus, right? This is the brachial plexus, right? Full one. So if you see these arising from this spinal cord are roots, which continues as trunk and which further continues divisions, cords and branches. So simply it's simplified here as an illustration. So we'll study about those individual component. See, the brachial plexus consists of 5 components, as we have summarized here: roots, trunks, divisions, cords, and branches. RTDCB. Okay, so this mnemonic we'll learn at last completely. So RTDCB: roots, trunks, divisions, cords, and branches. See, they process like this. They go like this along the upper arm and the forearm. Complete upper limb. They'll pass from the spinal cord. If you see here, the brachial plexus consists of 5 components. Those are roots, trunks, divisions, cords, and branches. See, roots are 5, trunks are 3, divisions are 6, cords are 3, branches are 5, as mentioned here in the mnemonic: 5, 3, 6, 3, and 5. First of all, roots which arise from the spinal cord, right? They are 5 in number. Roots are 5, so C5, C6, C7, C8, and T1. And the trunks are 3. The roots further goes and form trunks. Those are 3. They are upper trunk, middle trunk, lower trunk. So these are located in the neck. If you see in this diagram, see, this is the neck, right? So roots and trunks are located in the neck. So roots further goes and forms trunks. So roots are 5. 1, 2, 3, 4, and 5. They further unite to form trunks. They are 3. See, they are 3. Those are upper trunk, middle trunk, lower trunk. And they further divide and form divisions. The name itself says divisions. They are anterior division or ventral division, also called posterior division or dorsal division. So these 3 trunks will divide to form 6 divisions. That means each trunk divides into 2. That is anterior and posterior. So 3 into 2, 6. 6 divisions. They goes behind the clavicle. See, this is the clavicle, right? This is the clavicle bone. So this division goes behind, okay? Retroclavicular, we can also call this. That means they are going behind the clavicle. And the cords are 3. These divisions unite to form cords. Roots further forms trunks. Trunks further divide to form divisions. Division further unite to form cords. Cords further forms branches which goes along the upper limb. Then innervate the muscles. So responsible for motor and sensory responses. So the cords are 3. They are in axilla. Those cords are lateral cords, medial cord, posterior cord. If you see here, the divisions further unite to form cords. They are in the axilla. This is the axilla region, right? This is the axilla. So they further unite to form cords, which will pass along the axilla. So those cords are 3, which passes through the axilla. They are lateral cord, medial cord, and posterior cord, which further travels and form branches. Those are 5. The branches are not just 5, there are many branches, like those arising from the roots, those arising from the trunks, the branches those arising from the cords. Like this we have represented R5, T2, C from cord 3, 5, 5. So these are all the branches, but the 5 represents the most important nerves, like the musculocutaneous nerve, the median nerve, and the ulnar nerve, and the radial nerve. So they are like mnemonic RTC 5, 2, 3, 5, 5. So we'll discuss in further in this mnemonic. So first of all, be familiar with these 5 components, that is roots, trunks, divisions, and cords and branches. Those are 5, 3, 3, 5, and 6. So the components are 5. The brachial plexus consists of 5 components. They are roots, trunks, divisions, cords, and branches. So as of now, remember, the roots are 5, the trunks are 3, the divisions are 6, the cords are 3, the branches are 5, like RTDCB 5 3 3 5 and the 6, which is in the middle. So you can see in this line diagram. So this is the spinal cord, right? The vertebra, these are the vertebra, and this spinal cord passing through the vertebra. So the segments you can see C1, C2, C3, C4, C5, C6, C7, T1 and T2, T3, like this it will go. The spinal cord will go. But if you see here, from C5 segment, the root is arising one first root 1, and from C6 to C7, 3, C8, you have to focus here because there are only 7 cervical vertebra, but we get the root C8 extra beneath the C7. So the spinal nerves of this cervical are C1, C2, C3, C4, C5, C6, C7 and C8 also. 8 spinal nerves, cervical spinal nerves, but the vertebra are 7 only. So the C8 will arise beneath the C7 vertebra. So the segment arises like this. So first root, second, third, fourth and fifth. So 5 roots, as we have discussed earlier. 5 roots. These roots unite. See, the C5, C6 unite to form one trunk. The C7 alone forms another trunk, second trunk. The C8 and T1 unite to form the third trunk. See, first trunk, second trunk, third trunk. They unite to form one, second one, and third one. So 3 trunks. So see, trunks are 3 trunks. As you can see, these 3 trunks. And these 3 trunks divide. See, this one divided anterior, posterior, dot lines. Anterior, posterior, same anterior and posterior. So these divisions you can clearly see here. So 6 divisions. See, anterior, posterior, anterior, posterior, anterior and posterior. So each trunk divides into 2 divisions. So total 6 divisions are there. 6 divisions. And the divisions further unite to form, see, this anterior and this anterior fuse, unite to form one cord, and this posterior along with this posterior and the third trunk posterior forms another cord. This anterior segment forms another cord. You can see here anterior, this one anterior form one cord, the posterior and the posterior segment of the second division forms another cord, and the anterior alone forms the another cord. So total 3 cords are there. These are present in the axilla. See, cords are present in the axilla. So the cords further goes as a branches and innervate the upper limb. See, these are the branches. They also unite and they go like this and they innervate the muscles. So this one I have simply represented as a line diagram here. You can see the roots, the trunks, divisions, cords and branches. So the roots and trunks are supraclavicular, above the clavicle. The divisions are retroclavicular, that is behind the clavicle, and the cords and branches are present in the axilla, that is infraclavicular part. So roots, trunks present in the neck, and the divisions, cord, branch present in the axilla. See here. See, this is the shown body, right? So from the spine, this is the spinal cord. From the spinal cord, you can see roots arising. Roots form trunks, trunks form division forms cords, cords form branches. They innervate total upper limb. They go up to hand. So if you see, I have represented here one root, second one, third one, fourth one and fifth one. They unite. See, first root and second root, that is C5 and C6 unite to form one trunk. This is the trunk, and the C7 alone forms second trunk, and C8 and T1 forms third trunk. So 3 trunks. Each trunk divides into 2 divisions, anterior and the posterior. Second trunk, anterior and the posterior, anterior and the posterior. So these are divisions, 6 divisions. These divisions further unite to form chords. See, the anterior division of upper trunk and the anterior division of the middle trunk forms one chord, lateral chord. And the posterior division of upper trunk and the posterior division of middle trunk and the posterior division of lower trunk unite to form posterior chord. And the anterior division of lower trunk alone forms the medial chord. So these are the chords. The chords form branches. Further, the lateral chord divided into 2, and the posterior chord is also divided into 2, and the medial chord is also divided into 2. The medial segment of the lateral chord and the lateral segment of the medial chord unite to form one nerve, that is median nerve, and the other divisions along will travel through the upper limb and they innervate the muscles. So this is the overview course of the brachial plexus. Same as here. See, the spinal cord passing through the vertebral column. The spinal cord has C5, C6, C7, C8 and T1 roots, 5 roots. C5, C6 unite to form upper trunk. C7 alone forms middle trunk. C8 and T1 unite to form lower trunk. 3 trunks. See, 3 trunks, 5 roots, ventral rami, primary ventral rami of spinal nerve. So 5 roots, 3 trunks. These trunks, each trunk divided into 2 anterior and posterior division. Same anterior and posterior division, anterior and posterior division. So these 6 divisions will form. See, the anterior division of the upper trunk and the anterior division of the middle trunk unite to form lateral cord. The posterior division of the upper trunk and the posterior division of the middle trunk and also the posterior division of the lower trunk, see, posterior, posterior, 3 unite to form posterior cord, which is behind this axillary sheath. So posterior cord, and the anterior division of lower trunk alone forms the medial cord, and this cord further forms branches, 5 branches. So they travel along the upper limb and innervate. See, this form musculocutaneous now from C5 and C6, C7, C5, C6, C7, and the medial segment of, as I have earlier said, the medial segment of the lateral cord and the lateral segment of the medial cord unite to form median nerve, which is C6, C7, C8 and T1. And you can see here the posterior cord, which also divides into 2, as you can see from the back side, which divides into axillary nerve and the radial nerve. There is C5, C6 and C5 and C6 and T1. And this division of, and this remaining division of the medial cord is from ulnar nerve. See, marmo, M-A-R-M-U. Musculocutaneous nerve, axillary nerve, radial nerve, median nerve, and ulnar nerve. So just have an overview. We'll discuss in depth in further lectures. Same as here, same as it is. Be familiar with the topic so that you can understand everything. So I'm making you familiar with the topic by explaining the images. Same, you can see. So prefixed brachial plexus. So for that we have drawn C4 like that. But fundamental information you remember about the brachial plexus. Same, roots unite to form trunks. Trunks divide two divisions, anterior and posterior, anterior and posterior, anterior and posterior. The anterior, these two anterior unite to form cord, lateral cord. The posterior ones unite to form medial cord, and this anterior unit form medial cord. Anterior division forms medial cord. So this cord further forms branches, divided and form branches, they unite and they travel, so they form these branches. So they make RTDCB. 5 roots, 3 trunks, 6 divisions, 3 chords, and the branches. There are like many branches, so that's why I have written RTC 52355. We'll explain further. As of now, just remember branches. These are the like important branches. Marmo, MARMU, marmo. Muscularis nerve, axillary nerve, radial nerve, median nerve, ulnar nerve. So we'll discuss about individual component. Roots, these are 5 location, they are in the neck. Roots are constituted by the anterior primary rami. In the first part we have discussed what is anterior primary rami. The roots are constituted by the anterior primary rami of the spinal nerves C5, C6, C7, C8 and T1. So 1, 2, 3, 4 and 5 roots with occasional contribution from C4 and T2. We have discussed earlier, prefixed plexus, postfixed plexus. So if C of C4 is involved largely, so it's called prefixed. If T2 is involved in large contribution, it's formed postfixed plexus. So in this lagging diagram, you can see, if you see C4, C5, C6 and C7 and T1, T2 vertebra. So from that spinal cord will pass, right? So C4 segment, from the C4 segment, C4 spinal nerve, from C5. Okay, forgot about this. We'll learn about the most common brachial plexus, that is C5. The spinal nerve from C5 segment, C6, C7 and T1. This is C8. C8 and T1. 1, 2, 3, 4, 5. 5 nerves, spinal nerves. These are the roots. So roots are located in the neck. Roots are located in the neck. And the trunk. See, and the trunks. Trunks are 3, right? So roots further forms trunks. They are present supraclavicular part. They are present above the clavicle. So that's called supraclavicular part. So the roots further, see the C5, C6, C7 and C8 and T1. The C5, C6 root unite to form upper trunk. The C7 root alone forms the medial trunk. The C8 and T1 unite to form lower trunk. As you can see here, the roots C5 and C6 join to form upper trunk. The root C7 alone forms the middle trunk. The root C8 and T1 joins to form the lower trunk. See, this is the upper trunk, middle trunk and the lower trunk. Location. These trunks lie in the neck between the scalenus anterior and scalenus medius muscles, carrying the axillary sheath from prevertebral fascia. I will show you the diagram here. See, this is the scalenus medius muscle and this is the scalenus anterior muscle. Between these two muscles, the brachial plexus pass. See, you can witness here. Will pass. Actually, from the vertebra, there will be a prevertebral fascia which travels and forms axillary sheath. So between, they enclose, this axillary sheath enclose the brachial plexus, as you can see in the picture that I have shown. And the divisions, I have come to divisions. See, there are 6 divisions, as I have earlier said. The roots, which further forms trunks, right? Trunks divides, these 3 trunks divides into 6 divisions. They are present at retroclavicular part, behind the clavicle. See, C5 root, C6 root, C7 root, C8 root and T1 root. C5 root, C6 root unite to form upper trunk. C7 root alone forms middle trunk. C8 and T1 root unite to form lower trunk. This upper trunk further divides into anterior division and the posterior division. And this middle trunk further divides to form anterior division, posterior division. Same trend follows here also. The lower trunk divides into same anterior division and the posterior division. So total 6 divisions are there. See, each trunk divided into 3. Each trunk, that is 3 trunks divided into anterior and posterior division, also called as ventral division or dorsal division. Location, they lie behind the clavicle, retroclavicular part, as I have earlier said. See, these divisions join to form cords, right? Roots, trunks, divisions, and further form cords. See, the trend continues like this. Roots form trunks, trunks form division, division form cords. The cord further forms branches, Same. Roots, trunk, trunk. Anterior division, posterior division, anterior division, posterior division, anterior division and posterior division. See, the anterior division of the upper trunk and the anterior division of the middle trunk. See, clearly you can see anterior division of the upper trunk and the anterior division of the middle trunk unite to form the lateral cord, and the posterior division of the upper trunk and the posterior division of the middle trunk and also the posterior division of the lower trunk. These three posterior divisions form posterior cord, and the anterior division of the lower trunk alone forms the medial cord. This is medial cord. This is medial cord. One second. This is medial cord, right? So if you see the cross-sectional view, you can visualize like this. This is the lateral cord, this is the medial cord, and the posterior cord. If you take this as neck and the cross-section at the axilla, you can see lateral cord, posterior cord, and the medial cord, and see the two divisions, three division, one division, right? Upper trunk, middle trunk, upper trunk, middle trunk, you want to form lateral cord. See, you want to form two divisions of upper trunk and middle trunk, you want to form lateral cord. Three divisions of, that is posterior division only. The three divisions of upper trunk, middle trunk, and lower trunk, you want to form posterior cord. And the one division, that is anterior division of the lower trunk itself, forms the medial cord. So here comes the branches. Same trend follows here also: roots, trunks, divisions, cords, and the branches. And if you see here, branches from roots, there will be branches from roots, from the trunks, from the cords also. So don't be confused here. That's why I have wrote here RTC 52355. So this is a mnemonic. In the diagrams, in all brachial plexus diagram, they will give only MARMU, MARMU, musculocutaneous, axillary, radial, medial, and ulnar. Those are the main nerves, important nerves. But there are many branches arising from the roots and trunks and the cords. So you should write every branch of the brachial plexus, which are arising from 5 branches arising from the root, 2 branches arising from the trunks, and 3, 5, and 5 arising from the cords. What cords? Lateral cord, posterior cord, and medial cords. 3, 5, 5. So that's why this mnemonic came. They have wrote here. See the branches of the roots or from the roots. They are dorsoscapular nerve, long thoracic nerve, branch to phrenic nerve, branch to longus colli, branch to scalennimal. See, 5 are 5. So this apply to rhomboid, major, minor, levator scapulae. So the branches are dorsoscapular nerve, long thoracic nerve, branch to phrenic nerve, the branches to longus colli, and the branches to scalennial muscles. Why I am saying branch to phrenic nerve means it gives a branch to phrenic nerve. That's it. It's not the complete phrenic nerve. It just gives the branch to phrenic nerve, which unite with other nerve, other segments, and form the phrenic nerve. Same as this branch to longus colli muscle. So one branch to longus colli, and the branch to scalennial muscle. That is scalennial anterior and scalennial medius. We'll discuss, right? So the mnemonic to remember these nerves is STP long scale. Same RTD CB 5335 mirror image, and this is on 6 divisions. So the branches from the roots are STP long scale. S means scapular nerve, dorsal scapular nerve. T means long thoracic nerve, ST, right? And the P means phrenic nerve, branch to phrenic nerve, longus colli, scalennial muscle. So these 5 branches of roots are completed, and this part is extra information for you. If you can remember. If not, these nerves are enough to be remembered. So this dorsoscapular nerve innervates rhomboides major and minor and levator scapula. Long thoracic nerve is also called as nerve of Bell or nerve to serratus anterior, because it innervates, it goes to serratus anterior muscle. Same branch to phrenic nerve. Phrenic nerve supplies diaphragm, right? Diaphragm. And the branch to longus colli muscle, scalennial muscles, 3 pairs. There are 3 pairs of muscles, scalennial muscles. Same. See, this is the root, right? Roots, these are the roots, right? So 5 branches arising from the roots. See, dorsoscapular, or also called nerve to rhomboids, rhomboid major, minor, levator scapulae. And this one is completed. Second is the long thoracic nerve. See, long thoracic nerve or nerve to serratus anterior, because it supplies to serratus anterior. So it comes as a branch from C5. See C5, this is C5, and C6, C7 also. C7 goes like this behind that roots, and innervate serratus anterior muscle. So this is long, it's long, right? It's a long thoracic now. Thorax, it reaches up to thorax, and there we have zigzag muscle, serratus boxer's muscle, serratus anterior muscle. So it innervates that muscle. So second one, long thoracic, completed. Third one is phrenic nerve. Phrenic nerve is formed by many branches, but one branch of the brachial plexus contribute to this phrenic nerve, that is from C5, and other branches like C4, 3, C3 also contribute, but from the brachial plexus it is contributed from C5. Its further forms phrenic nerve, which goes and innervates diaphragm. And fourth one is a branch to longus colli, and one branch to longus colli from C6. And here C2, C3, C4, C5, C6 also is it's given course. And branch to scalene muscle. One, two, three. So these branches of roots, from roots, we have completed. So branch of trunks. See here, trunks 2. There are 2 branches, right? See, 2 branches, RT, 2 branches. See, from trunks, 2 branches. There is only from upper trunk, suprascapular now to subclavius. As the name suggests, suprascapular, this innervate to supraspinatus muscle and infraspinatus muscle, and then now to subclavius, supply to subclavius muscle. Same, these are the trunks, right? So from the upper trunk itself to suprascapular, and then now to subclavius, it innervates supraspinatus and infraspinatus, and this innervates subclavius muscle. Right, completed. See, branches of the cords from the cords also called. So lateral, posterior, and medial cord. See, 3, 5, 5, 3, 5, 5. You can see here, C 5, 5. See, 3, 5, 5. From the cords, branches from the cords. 3, 5, 5. As you can see here, the cords. These are the cords. Green color one are the cords. So remember, from the lateral cord 3, right? So this is the lateral cord, right? 3. Lateral cord. See, 1 branch, 2 branch, and this medial root of the lateral cord. See, the lateral pectoral nerve, musculocutaneous nerve, and medial root of the median nerve are the branches of lateral cord. The posterior cord are 5 branches. So this is the posterior cord, right? So you can say 1, 2, 3, and 4 and 5 branches. Those are upper subscapular nerve, now to latissimus dorsi, lower subscapular nerve, axillary nerve, and the radial nerve. As of now, remember like this. So the posterior cord 5 branches, same. Sorry, medial cord. See, this is the medial cord. From the medial cord 5 branches, 1, 2, 3, and this lateral root of the medial cord, which forms medial nerve, and this medial root alone forms ulnar nerve. So 5, same. Medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, lateral root of median nerve, and ulnar nerve. So 3, 5, 5. Remember, any mnemonic for that. L, lateral, medial, the posterior. Some of these chords, 3, 5, 5. Okay. See, L, M, L, M for U, ultra. The branches from chords. Right. Same. This lateral pectoral nerve, innervate pectoralis major and minor. Musculocutaneous nerve, innervate coracobrachialis, biceps brachii, brachialis, muscles of arm there, and the medial root of the median nerve, innervate anterior muscles of the front of forearm, and muscles of thenar eminence. So mainly the anterior compartment of the forearm, median. And you can see this one, upper subscapular nerve, which innervates subscapularis muscle. Now to latissimus dorsi, it innervates latissimus dorsi. Lower subscapular nerve innervate subscapular muscle, the teres major. And this axillary nerve to deltoid, teres minor. The radial nerve to triceps brachii muscle, and 12 muscles of back of forearm, the posterior compartment of the forearm. So that is also completed. So these medial cord, 5 branches: medial pectoral to pectoralis major and minor, medial cutaneous nerve of arm, medial side of the arm, medial cutaneous nerve of the forearm, and it goes further into the forearm, large area of medial side of the forearm, medial side only, and this ulnar nerve, which supplies to 1/2 muscles of the front of the forearm and 15 intrinsic muscles of the palm, hand muscles. See the mnemonic. RTD CB, 5 roots, 3 trunks, 6 divisions, 3 chords, branches. Separately we will discuss. Same. These branches from roots. There will also from trunks, from chords. So 5 to 355. 5 HDP long scale, 2 SSC, 355 LMP, LML, M4U ultra. Remember this mnemonic like this. Same. I have separated from that full brachial plexus, complete brachial plexus into part wise, so that you can understand easily. Simple. Same. We have repeated once you can go through it. Let me explain. See the lateral cord. This is the lateral cord, right? So 3 LML, lateral pectoral nerve, musculocutaneous nerve, and the median nerve, lateral root of the median nerve. Completed. And the medial cord. See, this is the posterior. This is the medial cord, right? So this one is the medial cord. From the medial cord, 5. 1, 2, 3, 4, and 5. So medial pectoral nerve. So M4U, M4U. Medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and a medial root of the median nerve, and the ulnar nerve. See, 1, 2, 3, 4, 5. Completed. The posterior cord. This is the posterior cord. Same. 5. 1, 2, 3, 4, and 5. So for this mnemonic, ultra. 5. Same. 5 branches. 1, 2, 3, 4, and 5. So for this mnemonic, ultra. ULTRA, ultra. U for upper subscapular nerve. L for lower subscapular nerve. Ultra. T for nerve to latissimus dorsi or thoracodorsal nerve. R for radial nerve. A for axillary nerve. So posterior cord also completed. For the next part, stay tuned. Thank you.